Hi, my name is Larissa. I'm going to be your med tech today. I'm going to be assisting throughout your Moss surgery. Before we begin, I want to make sure you're comfortable and understand completely what to expect today. I want to walk you through everything step by step. And if you have any questions throughout this explanation, feel free to interrupt me so I can answer those questions. So Moss surgery is a precise procedure that removes the basal cell carcinoma. Basal cell carcinoma is the most common type of skin cancer. It begins in the epidermal layer and tends to grow very slowly, but can cause damage to surrounding skin tissue if left untreated. In this surgery that we're doing today, the surgeon will remove one thin layer of cutaneous tissue at a time until all the cancerous cells are gone. The procedure will be done by a dermatologic surgeon who is a physician who specializes in diseases and surgeries of the cutaneous tissue and dermatological system. The surgeon will numb the area with a local anesthetic, which is a type of anesthesia, and then use a scalpel to remove a thin layer of tissue. That thin layer of tissue will be examined under a microscope in the lab to check for cancer cells. If any remain, another layer will be removed, and this process will repeat itself until all the cancer is gone. Because Moss surgery involves removing tissue in small sections, it helps minimize scarring. So the surgery can take several hours, just depending on how many layers of tissue need to be examined. Sometimes, because the lesion is on the lateral side of the face near the zygomatic bone, which is the cheek area, there's a higher risk of visible scarring. I'm going to give you detailed wound care to help minimize keloid or scar tissue formation. Most importantly is to keep the surgical site clean and covered. This is to help minimize the risk of infection. It's also important to avoid sun exposure during the healing process. Sun protection is especially important to prevent new lesions, erythema, which is redness. Your stitches will need to be removed in about 5 to 7 days, just depending on how your skin heals. So if it's okay with you, we're going to schedule your follow-up visit now so we can monitor your healing and ensure there's no signs of infection or edema, which is swelling. I know this is very overwhelming. I just bombarded you with a lot of information since I'm throwing all this information at you at once. We like to go over this information before and after surgery so that you have a fully understand the process and you're able to ask any questions you may have throughout this process. I want to make sure you're understanding what is going on at all times. Do you have any questions for me currently? No? Okay. When it's time for you to go home, we will send you home with paperwork that has all the information I've gone over with you in detail. So if you don't remember everything that we've gone over with you, don't stress. You have that as a resource, as well as being able to contact our office with any other questions that you may have or may come up. Do you have any questions at this time? No? Okay. I'll be here with you every step by the process. So if you feel nervous or need someone to lean on or have any questions at any time, feel free to ask. I'll see you again at your follow-up appointment next week. Does Tuesday or Thursday work?